Hi, it's Vanessa. We're at Newage today. I am here to see Courtney, our expert nurse injector. I thought we could have her give me a consult, see what she would think would look best on my face to make it more balanced. I am a current patient of Courtney's, have been seeing her for about a year now. So yeah, let's go ahead.
All right, come on in. Let's do some photos first. All right, and we're going to go to our treatment room. So the usual room, come on in. And you can have a seat on the white chair. The last thing we did was your microneedling and your toxin and laser hair removal.
Yes.
Has anything changed with your health at all since I saw you? So today is just me deciding what I think could look best.
Yes, and be as brutally honest as you want.
Okay, relax your head back for me. Your forehead looks perfect. And your toxin is still working a little bit. Try to frown. Yeah, and then raise your eyebrows. There's a little bit of it coming back, but obviously we don't need that. And you've never done any filler before, right?
No filler.
Yeah, okay. You're so beautiful and you really don't need a lot. If I was ever going to choose a few things, I would suggest we do the Redensity one under the eyes. Can I see you sitting all the way forward? I'm just going to look on this side. And then look straight ahead for me. Like this side, I think is perfect. This one has the slightest little bit of hollowing that technically we could probably do a little bit of tear trough filler, but we wouldn't need to jump to that. I would suggest doing like a couple rounds of Redensity because it would also help with like the brightening of the under eyes. And then I feel like honestly, your cheeks are quite nice. Technically, you could put a small amount of cheek filler, but I'm not saying you need it. I think for you, it would be fun to do a little bit of chin, a little bit to kind of bring it out, and maybe it would actually help because your muscles probably always trying to like clench a little bit, and so if it had a little bit of support. For you, it's just small things. I would continue with your microneedling 3 times a year. We try to do IPL. We should do a cool peel at some point. The regular things to maintain your skin, which I think are pretty easy and nothing with too much downtime at all. If you like the idea, we could do chin filler at some point. Or it would be fun to do a cool peel because you haven't done that yet, right?
No.
We've never done the Redensity under your eyes either. We've only done the skin boosters in your cheek. So definitely I'm talking about the Redensity one for the under eyes. It's an uncross-linked hyaluronic acid. So we would do it just underneath her eyes. So in tiny little micro droplets like skin boosters or mesotherapy. And it's gonna help brighten the skin. It's gonna help stimulate collagen. She doesn't really have a lot of fine lines, but it's more pigmentation for her. So it might help brighten the area up a little bit and thicken the tissue. Because we've been doing microneedling there. It would be nice to do the Redensity one for a little bit of skin boosting properties. The last thing, we haven't done it before, but will you activate your platysma bands for me? Yeah, and then relax it. So you're a little bit strong here. So it would be kind of nice as like maintenance and also preventative that it's not pulling down on that pre-jowl area. Let's show them what I'm talking about with your platysma bands so you activate them. So especially on this side, she's very strong. So see, it's really kind of pulling. Toxin easily works to relax that muscle and it would help with the jawline. So the last thing I'm going to mention is the necklines. Yours are very faint, but a lot of people ask me about this. They're not easily treated with microneedling. So I think we were taught that microneedling is going to improve them. I don't feel like it does. I think injectables work better. So whether you're using a light filler, such as RHA1, or you can use the Redensity one, the skin boosters, you need something physically plumping up the area. The microneedling alone wouldn't do anything. So if they bother you at all, then we could treat them with a little bit of HA.
Well, thank you for your honesty.
What would you like to do out of all of that?
Sign me up for all of it.